Good afternoon, everyone, and welcome to today's webinar. My name is Elena Balestra, and I'm Membership and Capacity Building Manager at the European Patients Forum. I'm really happy to welcome you all here this afternoon for the fourth chapter of our webinar series. Today, we're going to talk about e-health and telemedicine, and really just trying to understand a little bit more of what we're really talking about when we talk about e-health and telemedicine. Before we start diving into the topic, as today is going to be quite a session because we will have 3 speakers, I would like to provide you a few information on how to really enjoy as much as possible this webinar. I can just have next slide, please. Just a second, I will take control of the slides. Yes, perfect. So a few housekeeping rules to enjoy this webinar as much as possible. I would say you have a control panel on the right side of your screen. You can minimize it with clicking on the orange arrow on the top of the top of the screen. So to have the full view on the PowerPoint we're showing you. To ensure maximum possible interaction, you can raise your hand to ask the floor. If you do so, please make sure that you have a microphone at hand so we can hear you clearly and loudly. Or you can also decide to interact with us through our chat. So you can ask us any question, and please feel free to ask the question while they arise in your mind. So don't wait for the Q&A time. We will take all the questions towards the end of the webinar. Last but not least, if you have any technical questions, you can refer to the chat box as well, and we will try to get back to you with some suggestions. So if you have problems with your audio and microphone and so on. To make sure you can enjoy the webinar, if you have headphones and microphone, it will be great. Plug in your computer, try to disconnect other devices so you are really using all your band to enjoy the webinar. And I think we can now move on to the next slide. I still don't have control of the slide, so if you can, yes. And I can introduce the first speaker of today. You already see him actually on the screen. Is Nick Guldenmond, is Professor of Integrated Care and Technology at Sechenov First Moscow State Medical University, as well as a senior researcher at the National eHealth Living Lab of Leiden University Medical Center. He holds degrees in medicine and electric engineer, and he has been active in several projects. He has been working as a clinical researcher in numerous health innovations, so pharma, medtech, health, IT, AI, several projects. And he's also a key expert on e-health and integrated care, serving various governments on different continents, NGOs, as well as multinationals and startups. So, Nick, we're really happy to have you here with us today to start to unpack this crazy topic about digital health that is becoming so important and such as a buzzword almost, but very few people really understand what we're talking about. So we will really welcome your input today. I'm gonna disconnect my camera and Nick can leave you the full floor.
Yes, so good morning. I'm presenting from the Caribbean, where I currently work on healthcare improvement. And it's a great pleasure to give you this presentation. So the idea is to give you sort of overview of digital health, which is broader than just only apps or desktop application, the use of IT technology. It has much more implication and aspects than usually people think of. So let me take you through had this introduction. And let's start with general technology in healthcare. Okay, next slide, please. Can I control it myself? Yeah, very good. So the idea also within the European Commission is we have a lifespan, and well, usually when people grow old, they experience difficulties, and sometimes at an early age, you see that people are in need in care, episodic or for a longer time, and here you see a sort of course of events over lifetime. Next click, yes. So one of the challenges most healthcare systems have and population is to improve health in general of people, as well as the people who are healthy, but also those with existing challenges and difficulties, where the idea is how we can do much more on prevention, improving health, and technology might play a role in this. Next click. Sorry, one back. Yeah, very good. So if you look to technology, and technology is widely used in healthcare, but if you want to categorize them, there are technologies who can help to keep you healthy, or has sort of prevention focused in terms of applications, or in health education or risk monitoring. There are diverse solutions which are more focused, let's say, on prevention, healthy living, etc. And you see a lot of apps currently. For more the people with challenges and health challenges and chronic conditions, you see over the last years increasingly technologies such as in diabetes or cardiovascular risk management, where there are support tools in terms of apps or sort of devices which can help you to manage disease along with information solutions. There's a category which is more focused on home care, and usually a larger population of elderly might use that technology to be more independent for longer at their homes. And you have the sort of pure technology, which is basically hospital technology, such as MRI scanners or high-tech solutions in this hospital environment. And so you have different solutions if you look in healthcare wide. And you could say that the last 15 years, also due to digital technologies, that these technologies increasingly communicate with each other and share information to improve the process of care and to extract information to have more management information about population or organizations. Next slide, please. So if you look to how currently people use information, mainly through the internet, digital information for their health, some general characteristics based on a Dutch study. So you see that this was a study on the people older than 50 in the Netherlands, and you see this Dutch population is using internet quite intensely. Next click. Also, when it comes to health, and you see that 70% of this population older than 50 is using also social networks. Next click. So a significant portion of information on these networks and on the internet is about communication information about health. Next click. So there's also a lot of information looked for on search engines such as Google, about health status, about disease, about complications, about people themselves or maybe their relatives. Next click. And you can also see that still significantly people do use the information on the internet for their opinion, to establish an opinion on a matter. Next click. And also about 50% of the choices based on this survey is about care. And that can be very simple to a bit more complex. You can also think about groups specifically for groups of patients, relatives communicating about health. So you could see that in the modern age, we do relatively a lot online. Though we have to say that there are particular groups who don't have the access to the information, don't have the skill to search, etc. But still, so we see this is quite significant. Okay, next slide, please. Now we saw in the COVID times that in other sectors in the society, there was a huge growth of the use of apps for communication. This was true for education, for work, etc., doing shoppings. So healthcare is a particular sector which was also a bit conservative in using digital communication apps to have doctor, professional and patient interaction or interaction between professionals. Next slide, please. So this is something which is interesting. It gives a sort of idea that, well, the interest for using digital is rising in other sectors, but also in health. And so if you look to the use of digital application in health, you can also make a differentiation of what type of solutions they use. Already a little bit elaborated on the first slide, but for patients, there are applications available about information, about education, literacy, decision-making, and more on the medical side also, and for those with a chronic condition about or other challenges with diagnosis, intervention, and monitoring. Next click. The same is true for professionals. So also these sort of apps and information are available more from a professional perspective, providing information and some support on decision making in the sort of managing health and operational process. Next click. However, it's still that the sort of combination of interaction between professionals and patients or relatives is relatively scarce. So although they are widely available apps on all kinds of sorts, when it comes to organizing and planning care and communicate with professionals, this is something which really lags behind compared to other sectors. Next click. So also when it comes to connecting with the sort of supporting people for patients, relative, family, friends, work, etc., the whole informal care part, it's often not very connected to the communication between patients and professionals. Next click. So when it comes to organizing and planning care, and making it efficient and effective across different stakeholders or actors, professionals, this is still a lot to be done. And this is also where a huge challenge is to make healthcare for patients more effective and also for the professionals. So still there's a lot to do. It's largely fragmented. Next click. And the same applies also for information which can be used from people, professionals, patients, health in communities, municipalities, regions, to a higher level for policy making. So this is still largely fragmented, and accordingly we cannot capitalize on the information which is available in a real-time manner. So usually reports coming after a year, etc. So it's not that very fast as maybe it could be. Okay, next click. So despite the use progress in all kinds of applications and disease areas with digital health, and mental health is one of the front runners in using apps and also evidence-based solutions for helping people. And the same applies also to cardiovascular risk management, COPD, and diabetes. But these are the main areas where you see solutions for people. It's still very much standalone solutions. They're not integrated in a sort of workflow process from hospital, primary care, community care, etc. They may focus on single problems. So comorbidities, more complex diseases, also social aspects are usually not integrated in the current solutions. So along with the COVID crisis, there's increasingly interactions more digitally. So what an important message here is, next click, is that all these digital solution, which is wonderful, and you see a lot of enthusiasm, it's not the same as integrated care planning or efficient care planning across the whole chain of actions need to be done with from a patient point of view, but also from a healthcare perspective, including social care. So still we are dealing with very fragmented systems, although information, internet is everywhere. Next click. So we see this internet use, people are quite aware of it, that it is existing, but it's still fragmented. And you might get the idea that based on what you see on media, in programs, and that there's such a huge development going on, also in what they call artificial intelligence and the use of data to make healthcare better. And although it sounds very promising, there are also some major considerations when it's talked about. Because what I said, it's still very fragmented, the healthcare systems, but also the technology and the data. Usually also the solutions brought through artificial intelligence are also fragmented and standalone. So there's a lot of enthusiasm and almost a hype about diagnostics and screening and about prediction, but not so much about the support of people in care. There are all kinds of reasons, but there are mathematical reasons, statistical reasons, which is quite complex, but there are limitations on what you can do. So you see also some discussion on ethics, and that the data used is usually not representing maybe all the groups of patients, or it might be based on a very select group of people and not taking in consideration cultures or minorities, etc. So we have to be very critical about these aspects. And because they are so complex, it's usually very difficult to decompose, okay, what are the issues here? And there, I think also the European Commission, national governments and authorities should take more responsibility. Because also in this area, there's so much financial interest. There is a lot of interest from research, professors, universities claiming about what they can do with it, but it's usually they're focused on the budget, getting the budget in, rather than bringing solutions to patients. The same is for the industry, and even governments find it difficult to see where really the opportunities are and what are the risks. So this is a very delicate debate, and this is also where EPF can play a role in making this more clear and understandable for people. Next click. But I told you about the fragmentation, and I told you about the possibility of AI for bringing solutions, and we see some promising solutions are there. Digital service platforms, meaning they try to combine different aspects of healthcare using different sources of information and using this for better patient navigation or a better triage of patients along a process. So this is very promising, but usually also these platforms, there's investors involved, they want a return on investment. So it's not always very clear on where their interest primarily lies, whether it's improve of healthcare or it's to make profit for their shareholders. So this is still in development, but we see some promising developments. Next click. So looking from a patient perspective, next click. And you're looking for information on the internet, you're looking for help. And here you see a sort of stream, sort of steps people take when they are looking for healthcare. So you have usually a need. In this example, a mother with a child, they have questions and you can look for healthcare. And from a patient use perspective, these type of digital solutions, they tend to have a positive outreach, so they are quite active, they are in the media, so they can be found quite easily. So they use marketing approaches, which can be positive. But the downside is that they are not always transparent and objective. Next click. So they are 24/7 usually available. It's not bound to open hours. So that's good, and it might improve navigation for seeking care, but it also needs skills to do that. So it's not probably for all. Next click. So if you have found the sort of app and you formulate your needs through this application, usually we see that there's a high responsiveness in these platforms to help people, and they can answer a question relatively fast. There's no traveling involved, so that's also quite positive. But also here, it needs to sort of understanding about what is communicated and what's relevant for you. And this is different than you have a normal GP who knows your background and family, etc. Yes, okay. Go to all clicks. Yeah, very good. Okay, so you see that there's a low and no cost sometimes involved in using these platforms, which makes them also quite easily accessible. It resonates to this universal healthcare aim. But the downside is that also in these platforms, the cost of care might be in another step of the process. So the platform might earn money through prescribing medication, for example. So over-treatment, over-diagnosis is could potentially be a risk in using or in adaptation of these sort of platforms in healthcare systems. What we currently see also in the use of these platforms, that the satisfaction rate is usually very high. 95% is happy with the use of the service. But these are usually data collected by the platform themselves, which is not always maybe the same as a good good service from a medical perspective. A lot of recommendations are maybe not in line with what people think should be done. Also, doctors usually they should not always go with the opinion of the patient. Maybe had to recommend maybe not antibiotic and just wait and see in normal practice, GP practice. So this also is there's a need of evidence. Okay, next slide, please. So from a service perspective, and here you see also the same user, and an example, an illustration of how a platform works. So we see platforms who use artificial intelligence. You have an artificial intelligence with a sort of asking questions. It's a robot. And then you hand over to an online doctor. There are some platforms around, such as Babylon and elsewhere. So next click, please. So potentially this sort of platform who combines all these data from you and with profiles of other people, the advantage is centralized data, and you can do intelligence with this centralized data. And that's the advantage. But at the same time, it's also a risk with who owns the data and how is it with data protection. Next click. So we see, especially also in large studies in China, that the productivity of artificial intelligence in workflows, they can increase the productivity. So this is a good thing, because we have a lack of resources and we have to increase productivity. But at the same time, we also see that the algorithms used, the decision trees, which artificial intelligence is based on, that's what I said before, sometimes they are biased, just based on data sets which are not totally reflecting other populations. There's a problem with the sort of reliability of these answers produced by artificial intelligence, sensitivity, specificity, more complex concepts from statistics and methodology. So prediction, validity, all this sort of research and evidence-based hard evidence, does it work like it should work with a particular type of problem? There's still a lot of work to be done on that. And especially if you look at different stages of healthcare. So you see in the news diagnostic, on radiograph, for example, there is some achievement done, but that does not mean that the whole care process is improved. Next click. In line with the productivity and efficiency, so decision support can be better. Through all this data and the sort of learning programs you have in these applications. But usually the doctor is still on control. So the doctor usually in these platforms has the last say on what should be done and whether it's correct or not. As I already said, so there's a tendency to overdiagnosis and overtreatment because of this sort of system, technology-based system. And also for doctors, it requires specific skills and competences. So you really have to judge on the result of the computer, whether it's right or not. And this requires special skills, numerical skills, and not always doctors are trained for that. Okay, next click. Yeah, so in general, so again, quick response services online, they do follow-up queries to check whether they're right. So there are some check and balances in place in most platforms, not in all. So the clinical appropriateness is not always well justified. So that's where we should take care of. And also these digital platforms, they have the online doctor, and it's still quite relevant to have a good handover to the physical world. So if they refer, the handover, does it work right with a real hospital or a real GP? And this is in the early stages. So we are just at the beginning of mixing the digital worlds with these platforms and the real world of hospitals and primary care. Okay, next slide, please. So there's also a system perspective, next click, on these platforms. And this shows also the complexity has from a people's level to a whole healthcare system. So what we see that potentially these platforms and tools and applications can increase universal access for people, for patients, their relatives, etc. But we see also, because of the special skills needed, sometimes the money involved, it's not always available for everyone. On the right-hand side, you see also that there are some real-time information which is very relevant in healthcare to be, especially when this crisis, for example, with COVID. It allows personalization, which is good, cost reduction, efficiency, and also the scalability is much faster than you have the physical world with hospitals, primary care settings, etc. So there's a huge potential of these platforms. But we see overall it's very much profit-based. And you could argue, well, is this an overall societal benefit if these platforms becoming so dominant in healthcare system and having control over so many actors and data? So who's going to control this? Next click, and maybe click to the last click, because all these clicks, you see here, for example, just to give you the idea. So these platforms, just like Facebook, the Googles, and the Apples doing, so they connecting all kind of stakeholders in the environment, and they are dominant in controlling who does what, and they're making a business model out of it. So because of the huge interest in financial interest, about status, about economic power, because it connects also pharma, investors, and the big tech companies, we should really be careful on how this is managed. So you see, we in our area where the digital could potentially have a huge benefit for health, but there are also very much concerns, and because of the complexity, it's usually very difficult for patient organizations to have a real understanding what's going on here. How does it work, and who's involved, and who's controlling what? So I think with this last slide, I hope to provide you a little bit a sort of overview on this aspect, and hope we can extend the further discussion on this. Thank you very much.
Thank you very much, Nick, for sharing your presentation and this introduction with us. It's very useful and very intense. A lot of information, and I think our audience is digesting them. Please take your time referring to the audience to type all your questions in in the chat box while we move to the next speaker, and we will have a chance to ask any question and have a little bit of a debate with Nick towards the end of our session. Thank you very much, Nick, for now, and we'll see you shortly. I'm really happy now to introduce our next speaker. I see a lot of questions popping in. Please feel free to send them, and we'll look at them later on. I'll invite Jessie, who is our next speaker, to show her camera and see if we can hear her voice as well. Jessie? I'm going to unmute you. I'm sending you an unmute request. So you just have to unmute yourself. Okay, now you are unmuted. I don't know, Jessie, if you're speaking, but we can't hear you. All right, Jessie, we'll leave you time to fix this technical problem. You can chat with us in the meantime to find a solution. And I hope our next speaker in the line is ready to take over for a moment. Marcin, hi, Marcin. Thank you so much. Marcin is. And sorry, Marcin, you probably were going to have a snack, and I put you on the spot. Sorry about that. Marcin is represents one of our members organization. He's policy officer and Mental Health Europe, and he was going to close this webinar, but now it's going to be a short case studies introducing a bit how telemedicine, digital health, has been, and telemedicine mainly has affected mental health, the mental health community, and what are their feedback, because we know there's been a lot of development in the specific sector, and we wanted to hear that voice. Marcin, thank you very much for being with us today, and I'll quickly show your presentation. So I'll skip through a few slides and get to yours.
Thanks. Maybe I will meantime just start a little bit. So again, thank you very much for the invitation. It's been a pleasure to be here today and to listen. I found Nick's presentation extremely interesting, and indeed mental health was mentioned, and I'm happy that I can speak a little bit more about mental health. Indeed, as mentioned, I think I will be focusing more on telemedicine, so how the digital tools were used or are in use during the time of pandemic, and how the use of these tools accelerated during this time. Just for the sake of the connection, maybe I'm going to turn off my camera, and I will just speak in the background. As I mentioned, my name is Marcin Rodzinka, and I work for Mental Health Europe, and to use my 5 minutes wisely, I will try to put to your attention as many perspectives coming from our membership. So a membership of Mental Health Europe. So just to introduce a little bit the organization, I'm not sure I can click myself, so Elena, I would ask you to just very briefly about Mental Health Europe, who we are. So indeed, we are a member of the European Patients Forum. We are an organization that is European network of national and European networks and organizations. We have more than 70 members, more than 35 years of advocacy at the European level, and developing mental health services and building capacity across Europe. Next slide, please. And what we do, we very often, and that's kind of a crucial thing for us, is to put users of mental health services at the core of our work. So everything that we do is really to ensure their voices are heard across Europe, We advocate as well to make sure that positive mental health and well-being are given high priority in the political spectrum. We develop lots of recommendations, but as I mentioned, we also build capacity to improve mental health for all. And indeed, digital mental health as kind of an umbrella term is something that we starting to focus more on. So next slide, please. Just to give you an overview of who are our members, because I'm going to be citing some of them. So indeed, our membership includes users and ex-users of mental health services, their families and carers, national, regional, and local mental health associations, but also service providers. So those people that are in the form of community centers or hospitals are providing mental health care. We also have individual members and research institutes. But going back to the topic, so the COVID-19, sorry, not the COVID-19, but digital mental health, but actually COVID-19 is linked to it because it really, as I mentioned, helped to accelerate the use of digital solutions. Next slide, please. So really the COVID-19 has really catapulted digital mental health into the mainstream. As a response to the COVID-19 impact on mental health. It has led to really to the substantial increase of investments in digital mental health, and that's clearly visible, at least in the United States, but as well in Europe. So let me introduce you a couple of our members. We asked all of them about how they adjusted their services delivery. Of course, those that are service delivery service providers. And how did they manage to cope with the pandemic impact on their users, their loved ones? And indeed, it's clear that that digital was at the forefront of kind of dealing with the impact and maintaining the continuity. So as you can see here, you can see the quote of two of our members. One is Paul Bomke, who is a chief of Fallsklinikum from Germany, a big service provider from Germany. For them, there was a great reluctance to introduce digital solutions before the pandemic, but when that became a necessity, digital solutions really became part of their provisions. Now they are integrated part of their provisions. It's something that they do and provide daily. Simon, who is another service provider from Italy, in his contribution, he highlighted that the organization managed to adapt quickly to something that they didn't manage to achieve for 10 years before. So it was really, again, a very speedy process for them to implement all the solutions that they're now working with. And from his experience, this is actually quite interesting. He doesn't think that there are a lot of barriers for the providers and for users and patients of mental health services to use digital solutions. Here we talk really about the telemedicine, so different tools that enable people, providers, and users to connect and to maintain the continuity during the time that other provisions or forms of care and support are not possible. However, what he insists on is the fact that, and here indeed I would a bit argue with what Nick said before, just to say that we hear a lot from our members, and we also find this information in the literature, that the evidence for mental health digital solutions, and I know that we mainly here talk about the applications, it's not great. I mean, there are lots of questions about how this evidence is developed, and whether those solutions are really based on evidence related to their effectiveness and efficiency. So next slide, please. So continuing the perspective of the users, we've heard as well from Louise from Scotland, who is the acting director of the Scottish Recovery Network. So it's a peer organization. So for them, the perfect solution that worked using digital tools was a blended approach. So something that is a mix of digital connections and still face-to-face, where possible, interventions. What actually she mentioned, and it's quite interesting, is to say that digital tools really empowered peer support, in a sense of people with lived experience were able to really kind of accelerate their activity and to provide more support throughout this time. So peer support really has flourished thanks to the digital tools such as online solutions, but even telephone, simple as that, and others. And the last point that she mentioned, and I think it's very important to highlight as well, is that the digital again helped the third sector providers of mental health support to show that they are really effective, able to adapt to the changing environments, and they are really kind of a new future for mental health and well-being. So the next slide, please. Now moving to the perspective of users and patients and family members. So a little bit of a different angle. Here we hear more concerns, I would say, concerns or points that should be taken into account. So, for example, what our member from Spain, Guadalupe Morales, who is a director of Fundación Mundo Bipolar from Spain, she said that indeed for her, digital barriers exist. And that's something that is, from her perspective, on the side of users of the solutions, that this is something that needs to be addressed because it's basically something that keeps people away from using these tools. For Dominique, who is actually our senior policy advisor for youth and the CEO of an organization from Germany, for her, it was a very helpful tool during the time when other support was not possible. But she also mentioned that this cannot replace meetings in person. So that's something to keep in mind, and in favor again of this kind of blended solution that I mentioned. Interestingly, the last point that we've heard was from Sarah, who is a family carer, and she said that indeed for her son, digital support, so telemedicine mental health, was not an option during this time. And for her, for example, for her son, having a physical contact with a mental health support or workers would be something that was really needed back then. And next slide, please. So just to conclude with a couple of general remarks about digital solutions, telemedicine, and mental health. Indeed, it's something that helped a lot during the time when it was really, really needed and is still needed. But indeed, something to consider is the evidence for digital mental health solutions, especially the applications, about their efficiency and effectiveness. There's a lot of concerns, but I'm not going to go into details because Nick highlighted all of them, or most of them. What's important actually to ensure the efficiency and effectiveness of all the solutions is to involve everyone, not only users, not only providers, but also clinicians and researchers in the design of those tools that are used in mental health from the idea level, from the inception. That's something that also became clear after talking to our members, is indeed the issue of digital literacy and inclusion of the isolated and vulnerable communities, meaning that not everyone can be reached using digital tools. It is indeed helpful to reach those that are hard to reach, but we still have lots of communities that we work with that this is just not going to work for them. So we need to think about something else. And the last point that indeed was highlighted by lots of our members is this blended approach, that digital options are of a great support to providing mental health support and care, but they cannot be used as the only solution. They should be accompanied by face-to-face contact. At least that's something that we hear from a lot of people. So I think I will finish here, and I'm very happy to hear your questions and to answer some of them at least. And thank you very much for your attention.
Dear Marcin, thank you very much for your presentation and for presenting the view of your community. That was really enriching, and I'm sure that not only the mental health community can rely to what has been said. And I saw some questions popping in, and we'll return to that. So we'll give it a try to see if we can finally connect with Jessie. In the meantime, Jessie, if you can just say hi or try to see if your microphone is fully functioning now, that would be great.
Hi, can you hear me?
Yes, we can. That's great. Brilliant.
Okay,
Fantastic.
I'm on my phone. That's good.
That's great. So let me retrieve your presentation. And brilliant. So Jessie Connett, I can finally properly introduce you. Jessie, if you want to put your camera on just for a second to show your face, but not obligatory, obviously. She works at Traverse, who is a consultancy based in the UK. She is head of healthcare and social care. She's been working to enable people to have a voice in all aspects of healthcare. And lately, she's been very busy in working on several research linked to COVID. And one of them, which actually was done in partnership with National Voices, with our EPF National Coalition in the UK, is a member of us. And we came across this very interesting research that presents, that it's called in a very nice way. The doctor will zoom you now. So she will tell us a little bit more about what is background of the research, how you came about doing that, and what most importantly are the results, and what are the interesting learnings for patient advocates that might have to give feedback on any type of application or system that will have to be put forward by healthcare systems or any government. Jessie, thank you so much for being with us today, and we're happy finally to be able to hear your voice, despite all the trouble. Jessie, the floor is yours.
Thank you very much, Elena. Just checking you can still hear me.
Yes.
And I'm sorry you can't see me either. I'm having to do this by my phone, and it wouldn't normally be me to be shy. So I'd like to be there, and I'd like for you to be able to see me, but unfortunately I can't make it work. So nonetheless, I hope I've got an interesting presentation for you this afternoon. And first of all, can I just say thank you so much for having me, and I hope that I can offer you something interesting and useful this afternoon. As Elena said, my name is Jessie Connett and I work for Traverse. Traverse is an independent social research organisation. We specialise in qualitative research, evaluation, engagement, and also consultation. And this particular piece of work, we were privileged to work with National Voices, as Elena mentioned, and also Healthwatch England. For those of you that don't know who Healthwatch England is, Healthwatch is a national England-wide network of organisations that exist at the local level. And each local area across England has a local Healthwatch, and the organisations act as the eyes and ears of patients and the public when it comes to health and social care. Healthwatch England is the organising body that sits at the national level, and we work together with them. Elena, if you could do the next slide, that would be great. So just a bit of background, please, onto the next one, and I can give you some outline. Thanks very much indeed. So the project, as Elena said, the doctor will zoom you now. In many ways, our objectives were to fill the gap that we could see that was emerging that related to patient feedback about new ways to access care, particularly remote care. We could see that there was a rapid change taking place, as I'm sure many of you have also experienced, moving from more traditional methods, which we were all familiar with, meaning that we were having face-to-face appointments mostly with our healthcare practitioners, to a situation where the majority of those were taking place online. And we could see from our early conversations with members of the public, patients and carers, that this experience was very new and that there was some really interesting insights that we could gather about people's experiences of that change. Our main aim was to inform developments. Thank you. Next slide. So just a little bit of background in terms of who we spoke to. This was a rapid research study, and it took place back in the summer when, in many ways, the COVID pandemic and the lockdown in England was at its most extreme. So we aimed to talk to people in sort of real time. We spoke to 69 people in total who'd had some kind of remote appointment during lockdown, and that varied. It varied between telephone appointments and online appointments. We took a mixed approach to recruitment. We worked with Healthwatch and we went out through their local networks to identify people who could share their experiences, and we looked to get as diverse a group as we possibly could, but in the context of it being a rapid study. It was relatively diverse, and we were pleased with the ethnic mix, but it was slightly skewed to an older and a female population. We engaged people in two ways. We invited people to participate on an online panel. The panel was provided by an organisation called Recollective. You may be aware of it. It's an opportunity for people to sign in, log on. It works a little bit like a social media platform. People create a profile and then they're able to undertake tasks and activities, answer questions, interact with each other. We also spoke to people on the phone. We had 20 telephone interviews that were carried out by our National Voices colleagues. And we also held a focus group at the end, and we invited people that had taken part in the process to join us to review emerging findings and to share their experiences as a group. Thanks very much. Next slide. Just to give you a sense of the kinds of feedback people gave, and I think probably unsurprisingly you can see that people felt very differently about this experience. For some it was anxiety inducing, frustrating, and for some it was quite stressful, whereas others found it to be a really good experience. They felt well looked after, they felt listened to, they found it was an easy process. And I think, you know, the main thing from this is that no one size fits all. And as I share some of the themes, perhaps that will come more, a bit more apparent as well. So next slide, please. So just to let you know some of the themes and to give you a bit of an overview of each one. Through our conversations, there were a number of themes that came through. None of these are rocket science, but it's helpful, I think, to see them in this context and to see them in the way that they have come from people and their lived experience of receiving care in different remote ways, and particularly in the context of COVID. So the first thing that people talked about was boundaries. What people found was that where in usual ways they would make an appointment, they would prepare themselves mentally, they would travel there, they would be in a consulting room or a general practice, and in a way they would be in the zone, they would be in a kind of demarked space in which they were receiving their healthcare. What they found with the virtual healthcare or remote healthcare was that it was tending to kind of bump into their life. So they were given a time slot, and sometimes those time slots were really broad. And what people were finding is that they were then sort of spending the day clock watching or waiting for a call, and finding sometimes that they were having to have a healthcare appointment whilst they were in the park with the children or getting the dinner ready. And so there was a really strong message about actually this needs to work whereby it respects the boundaries of my life while I'm getting on with my life, and the appointments fit in. The second one, and I think this is probably a really obvious one, but it's so important that we don't lose out, that quality personal communication matters no matter what. So just because appointments were taking place more remotely, maybe by phone, perhaps by video, and in some cases more by email or text, the quality of the communication was just as important, and in some ways more important. Less visual clues, sometimes people needed to take things slower or have things repeated. The next one there about preparation and information. Oh, thanks. Preparation and information. This was an opportunity for people to just get some information in advance so they knew what to expect. That allowed them to do some preparation in advance. And in some cases, that was somebody saying, can I run this past you as a friend? Can I try out my video technology? Perhaps I should have done that today. But it was an opportunity for people to kind of, get prepared, do the information, and feel as if they knew what to expect, that it wasn't happening by surprise. Choice was a huge issue, and I think one of the main findings that we got from our contact with people was that there is no one single size that fits all. In an ideal world, people want a choice. They want to be able to have a phone call when that suits. If it's then helpful to go on and have a video, or maybe share some text or an email, and then in appropriate situations or where the situation requires it, the opportunity to meet face to face. People saw that no one size fits all, and what was right for the person and what was right for the situation needed to be adaptable. Testing, learning and improving was really important. Of all of the people we spoke to, not very many, only 3 people were actually actively asked what could be better about the experience. So only 3 people were asked to give feedback. A missed opportunity, we feel. This is a process of development and ongoing improvement and design, and asking people about their experiences as they go is a valuable insight. Being inclusive, there's clearly a really big issue about those people who aren't able to get online, either because they don't have access to Wi-Fi, they don't have access to hardware, and in some cases they don't feel confident and they don't want to get online. Really recognizing that there is this range of people and different needs, and being inclusive in the way that people can access their care is important. The last theme is one around opportunity. For many people, they had different views on remote care, but one thing came through loud and clear. For many people, they saw, as long as it didn't have to be the only way to have care, they saw a huge opportunity. It was easy for people to access. They didn't have to leave home. They didn't have to come into environments where they might have been worried about contracting COVID. But there were some other things as well, such as sharing notes or being able to share information in the chat box, recording appointments so people could go back to them afterwards, and using it for education and training purposes. So some headline themes there. Next slide. Not to take up too much more of your time, but digital inclusion, just to spend a moment more in relation to this. We know that a significant proportion of the population is digitally excluded for different reasons, but we also know that this exclusion isn't equally distributed. So some people experience greater levels of digital exclusion. We also know that this tends to align with people who have higher health inequalities too. One of the really big concerns is that we don't compound existing health inequalities, that we don't make those people who already struggle to receive care, we don't make that further difficult for them. And as I mentioned earlier on, at the same time, technology can be a great enabler and actually enable better inclusion, particularly around accessibility. Thank you. Next slide. I mentioned earlier the opportunity to test, learn and improve, and I don't wish to dwell on it too much longer, but there were some really good standout things here. Information sharing, online and remote technology is a really great opportunity for doing that. The improved accessibility, as I've mentioned, but one of the further things, and perhaps one which is less easy to, not as tangible, but potentially even more powerful, is actually this opportunity for remote care to provide a different dynamic, a different power dynamic. A number of people that we spoke to inferred that the remote consultation process actually created a more equal space for care to take place. It offered an opportunity for people not to feel as if they were the guest in a space that is owned by somebody else, and that the remote space was one which was one of parity. I think this has some real opportunity to explore when we think about how to really make the most of this new type of engagement and communication in health and care. Next slide, please. So just as I come to the end of my presentation, I've got 2 more slides, but I won't spend time reading them all out to you. Just to say, one of the things that we wanted to do as part of this research was to deliver something practical, something useful, something helpful. So as well as being helpful research, we wanted to be able to offer up some useful things that people could do differently. As a result, we identified a series of top tips. We identified those that seemed to be most useful for patients, and we also identified a number that were useful for health and care professionals. And we deliberately wanted to put them on the same piece of paper together so that patients could see what to expect from health and care professionals, and health and care professionals could encourage patients the other way. Next slide, just so that you have information, and I can make sure we get a link to all of these documents for you. We also created an easy read version that picked up some of the key highlights of the reports and also the top tips. So this is a document that is written in easy read, and we hope it supports people with a range of different needs to be able to access the information. I think the next one's the last one. Oh, just a couple of questions. Yeah, go to the next slide. And it's not so much necessarily for you to kind of consider now. Two last things. This one is really just about saying how digital and remote care needs to change. There's quite an emphasis sometimes on getting the actual digital process right and making sure the systems work. But it was a clear message for us to say, please take the time to understand how the system works in relation to real people's lives, to view the holistic patient journey, not just when they interact with the remote technology, but from the point at which a person identifies the need to communicate with a healthcare practitioner, right the way through to the point at which they identify that their needs have been met. Thank you. Two last questions to leave you with and to mull over. How do we make sure we don't leave people behind and further deepen health inequalities? And what are the opportunities for patients and healthcare practitioners from this new form of communication? Thanks for having me here this afternoon. Thank you.
Thank you very much, Jessie, for your contribution and all our speakers today. We are a little bit behind schedule, but we'll try to catch up with some questions. If Marcin and Nick would like to come on camera, and I know Jessie, you can't, but you will stay with us for some questions. I'll now open the floor and try to look into all the questions that we've been receiving so far. I also wanted to remind all the audience that this webinar is being recorded, so will be available on our YouTube channel, and you will also, as participants or registered, you will receive a link to be able to enjoy once again this webinar. So we have Peter Carey from Hungary, who is asking, how would you, I think this is for Nick, how would you help patients to exclude self-help apps, Google Play, that are not based on evidence, not reliable, or not refreshed, so to be outdated? And I think he's also thinking, and maybe this Marcin can chip in, that he was, for example, mentioning suicide prevention line is not working after the help pages. But the apps, oh yeah, he's giving an example saying that, for example, there are some apps that support, give a little bit of support in suicide prevention, but they say that actually once you download and you have them, the app doesn't help you to really get in contact with someone, so it's a sort of a totally useless one. And just giving an example by saying that there are several of those and they're all available on Google Play and other platforms, so that could be quite disruptive for patients. How can we eventually prevent that or direct people to the good ones?
Mm-hmm. Shall I respond?
Yes,
yeah.
If you can.
Yes, so regarding evidence and accreditation of applications, so there are many activities going on by different organizations. So there are some databases available which provide a sort of overview of accredited health apps. I think the European Commission is working on this. You have some national initiatives, and also some professional groups are working on this specifically for disease areas. So that at least provides some reliability for people. When there's no accreditation, or I think it's better to discuss it with the healthcare professional involved in this, and you look together whether it might suit your needs, and use common sense, or ask support from other fellow patients to maybe recommend this. So it probably requires a sort of vigilance and in this process. Yeah.
Marcin, would you like to comment somehow, maybe in the patient community, in your patient community, some?
Yeah, sure. Just very, very briefly. So I agree with what Nick said. I think here we have to control more the quality of the applications that are available. I saw the research, for example, checking the indeed Google Play and app stores and all the applications related to mental health available there. I mean, if I'm not mistaken, around 3% had the reliable evidence behind them. So I mean, there's this huge gap between, you know, what people are able to download and use with the good intentions, and I think there's also good intentions behind development of this kind of applications and tools for people. But indeed, as you know, I think there is maybe not a need for great regulation, because that's not always, you know, a great approach. But indeed checking the quality and evidence behind the applications. And I think the last point, I might be wrong, but you know, what I think is that we cannot leave, you know, the only support available for people or the one that is actually accessible to be a digital support, because I mean, there should be, maybe people turn to you know, to digital solutions as an easy solution, because you know, other services as well that should be in place are not available, for example. So just thinking that it's, you know, it's a very complex thing.
Yeah, no, absolutely, and I think it happens in all spheres, from nutrition or tracking menstrual health cycle, for example. I mean, there's everything out there that is absolutely even wrong sometimes. But I think as soon as you are able to develop something, you can put it on the market or even for free and just see the reaction. So yes, I agree with you, and I think there will be the challenge of the quality. You know, we're putting a lot of things out there, but then, you know, there should be a selection process, and not always the public is not always informed to do that. I'll ask the audience to keep sending their questions if they have any. It's really the moment to tap in the expertise of our experts. Julia Nordin for Sweden, she's commenting that actually, well, thanks you, the three of you, for the great presentation and insights. And she's saying that also in Sweden, the digital health has been growing very rapidly in terms of youth in the past years, and definitely in this past months. But she's mentioning that one of the downside is that people seem to use it for minor health issues more than for bigger things, and this becomes very costly on the healthcare authorities, that they have to sort of create these two channels. And do you see that this is also an experience in other countries, or you see it more as an anomaly? And do you see that this is one of the risks in digital health development?
If I can just quickly comment on that, I think we've heard similar comments and perspectives from our members. So, for example, Simone from Italy elaborated a little bit more on that. That, you know, in their service provisions, they indeed kind of supported themselves with using digital tools in managing, let's call it like minor problems, you know, related to mental health. But for more serious cases, they maintained as much as they were able, you know, physical services for people. So I think that Swedish example that one attendee just brought up, I think it's not an isolated issue. And indeed, there's a matter. I mean, there's a question about, you know, costs. I don't have exact data, but I think this is something that, you know, that should be kind of, that we should all look into.
Yeah, I agree with Marcin. Also, this problem of the handover to the physical world from digital to physical is still very problematic in terms of people. So the connection between digital health platform with real people, but also in terms of how does it work with finances, the technology available to share data. So there are all kinds of issues which are system related. And this also shows the sort of challenge. If we really want to improve not just care for people, we need to change systems. So the very practical level to a system level, the one doesn't go without the other. And so I think also for patient organization, the implication is of course, we have to look at the need of the members and the people's concerns. On the other hand, we have to collaborate in order to promote the interest of the people on a systems level. And EPF is important that, but also independent patient organization in order to create this sort of counterforce for all kind of digital developments.
Yeah, no, absolutely. Well, I think we are running a little bit over time, so for the sake of respecting the time of everyone, and mainly you speakers and definitely our audience, I will now close the Q&A time. It's been really wonderful to have the three of you with us today. To all the audience, you can see their contact details on their presentation, so you can still reach out to them. Definitely also very interesting justice research, and I would be very curious to know if in other countries have been doing something similar, and definitely in the future we'll see more. I think some of the key questions asked towards the end would be very helpful for our patient community in connecting with everyone that would like to develop such systems in the future. Well, sorry, Jessie, you wanted to say something?
No.
Okay, super. Well, thank you so much. Yes.
Yeah. So anyway, I'm happy to provide some answers if questions coming later from this webinar. So that's no problem. So discussion can be continued when it's me concerned. So.
Absolutely, and we'll have a chance to definitely talk more about digital health, because as we said, it's something that we recently started to work on. There's a lot of interest from our members to gain more knowledge about it, and me as well. So we'll definitely take the time to have more moments of learning all together. Once again, it's been a pleasure being with all of you. We had a lot of attendees and even more people registering, so they will watch the video afterwards. I wish you all a very lovely afternoon and a lovely weekend when you will get to it. Thank you so much.
Thank you very much.
Bye-bye. See you.
Bye-bye.
Bye.